Hello, everyone, and welcome back to Atlantic Coast Aesthetics. I'm Matt with ACA, and joining us once again is Dr. Thomas Pane, Chief Medical Officer and founder of Atlantic Coast Aesthetics. And in this week's question of the week comes from our Twitter crowd. And Dr. Pane, this question is about liposuction. This lady's had liposuction about 8 weeks ago. They've had about 1.5 liters of fat removed from their abdomen, arm, and back. Feel like that not enough fat was removed, and possibly seeking another surgeon for a reason. Also, they're wondering, should she get more fat removed and also a tummy tuck? They have no loose skin or stretch marks, and have only had one child via C-section at 33 weeks gestation. So kind of a complicated question. Dr. Pane, what would you suggest in this case?
Well, complicated questions, not a problem. What I see on those pictures, now we don't have the height and weight, we don't have the previous pictures, but what we're looking at here is somebody with pretty good skin. There is some fullness there of the abdomen, and I would caution anybody to be too critical too early on. We're only 8 weeks out. 1.5 liters was removed. Oftentimes you can get more than that. It kind of depends on what you're starting with. The limit of safe fat removal in Florida in an outpatient setting is 4 liters, but it's important to keep in mind, not that many people reach that. So 1.5 liters may be completely appropriate for her body style. It is hard for me to say that completely. Again, at 8 weeks, the swelling is starting to go down. Most of the hardness of the abdomen should be peaked, but we do not have the final result. So we can't say it definitively. What I would recommend is continuing to follow the instructions, doing the massages, wearing the garment, trying to get things softened down and shrink till we get to our final result. You get most of your final result between around 3 and 6 months, depending on which areas were done and how much fat was removed. It's a little too early to talk about revising right now because you're still in that healing process. And a tummy tuck here, while it is possible to do, probably isn't going to be the option given that the skin is not loose. One difference to keep in mind is if the abdominal wall on the inside is bowed forward, then liposuction is not going to help that. And that is the one patient type of patient that they may not have a lot of loose skin, but they sometimes can still benefit from an abdominoplasty because you are tightening that inside abdominal wall. So for right now, don't get too worried about it. Continue to do what you're doing. See where you are. You've got another couple of months to figure out what's going to happen and then create a plan from there. Going back to take more fat is possible if it looks like there has been some left behind or there's residual areas that weren't addressed. Tummy tuck probably not going to be needed, but a possibility depending on what's happening with the anatomy on the inside. And again, we can't answer that definitively here, but that covers the basic options from where we're starting, from what we've heard here. So I hope that helps.
Well, thank you, Dr. Pane. We appreciate your time. And if you have a question for the doctor, please visit our Facebook page or website. And Dr. Pane, we appreciate your time once again, and we'll see you on the next question.
Great. Thank you.